connected by purpose, driven by passion. Welcome to the Spark Live webinar series, where we gather to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities. Keep up to date on all of Children's Healthcare Canada's webinars, events, and announcements. Sign up for our Spark News e-bulletin by visiting our website at childhealthcan.ca and follow @childhealthcan on Instagram, X, and LinkedIn. Now, on to today's webinar.
Hello, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series, a service to our members, strategic partners, and the child health research community. I'm Paula Robeson, your host for the next hour. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin and Anishinaabeg peoples. We recognize and deeply appreciate their historic connection to Ottawa, and today Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to working towards forging new and deepening existing relationships that include First Nations, Inuit, and Métis peoples, and we are grateful for the opportunity to share this land as we work to measurably improve children's health outcomes from coast to coast to coast. We're delighted today to speak with colleagues Sonia and Cynthia about Engage, Educate, Empower, a co-designing a digital tool for youth mental health literacy. I'd like to introduce our speakers for today. Sonia is a health services researcher at the Applied Health Research and Knowledge Mobilization Lab, working under the mentorship of a distinguished researchers Jenna Parsons-Lee and Stefana Julia Moss. Sonia holds a Master's of Health Administration from Dalhousie University and a Bachelor of Science in Cognitive Science from Mount Allison University. Sonia's passions and research interests include patient safety, community-engaged research with a strong commitment to advancing equity, diversity, and inclusion within the healthcare system. She focuses on improving health outcomes for equity-deserving groups with a particular emphasis on children and youth. Sonia aims to create meaningful and lasting impacts in these communities to ensure that all individuals have access to high-quality healthcare and support. Cynthia is a second-year medical student at Dalhousie. She's graduated with an honors of Bachelor of Science in Kinesiology and a Master's of Public Health from the University of Western Ontario. Cynthia has worked at the CIHR Institute for Human Development, Child and Youth Health, and later at the Applied Health and Knowledge Translation Lab under the supervision of esteemed researchers Jenna Parsons-Lee and Stefana Julia Moss. Her experiences in research and policy have inspired her to become an academic physician with the goal of improving patient care and well-being, especially among children and youth. And thank you for your answering the poll questions, and we're over to the speakers now. I'd like to hand the presentation to Sonia.
Wonderful. Can you all see my screen?
We can.
Awesome. We'll get right into it. So before we begin, we have a little bit of an interactive portion to our presentation. So if you'd like to partake in some questions that we'll pose and we're looking to get your feedback on, you can scan the QR code on the screen right now using your mobile device or opening up a new tab and going to slido.com. And you can add the code for today, which is CHC Spark. So before we begin, I would like to extend the land acknowledgement previously made and also add that Dalhousie University is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq. We are all treaty people. We also recognize that African Nova Scotians are a distinct people whose histories, legacies, and contributions have enriched that part of Mi'kma'ki known as Nova Scotia for over 400 years. My name is Sonia, and I'm really excited to speak to you all today about this project. As briefly mentioned, I'm a graduate researcher with the Applied Health Research and Knowledge Mobilization Lab at Dalhousie University in Halifax.
And I'm Cynthia, a second-year medical student working with the lab to finish my research in medicine project.
So we are really excited we are both very excited to talk to you about our project on co-designing a digital tool for youth mental health literacy and the resulting tool, MindTrack. So our lab is led by Dr. Gina Parsons-Lee, who is an associate professor with the Faculty of Health, and the Youth MindTrack project has been a collaborative effort with Dr. Stefano Julia Moss, an assistant professor in the Faculty of Medicine. Beyond this project, our lab focuses on Beyond this project, our lab focuses on a wide range of topics, including public health crises like the COVID-19 pandemic, patient safety, vaccine hesitancy, and health equity. We're especially passionate about community-engaged research, bringing the voices of patients, families, and healthcare providers into the conversation. And here you can see our lovely team on the screen. So here is a quick overview of what we will be talking about today. So we're going to tell you a little bit about the project and the foundational research and background that went into it. We'll go through the phases of the project and its overview. We are then going to look at evidence-based consensus statements that we put together. What does that mean? How did we do it? And how that led us into the development of the Youth MindTrack and pilot testing. So talking about the foundational research. So our initial goal was to understand the mental health needs of youth and children in order to effectively address them. So from 2022 to 2024, our team was actively building a strong foundation of published work that guided the conception, development, and execution of the digital tool. At the start of the pandemic, we conducted 2 survey studies to gain insights into youth mental health needs. As the pandemic progressed, we followed up with interviews to deepen our understanding and capture the evolving changes youth were facing. As you can see on the screen, the findings from our interview study are currently undergoing peer review, further validating our approach and ensuring rigor in our research process. After several years, with the growing body of literature available, we conducted knowledge synthesis projects to analyze interventions that had been implemented during the pandemic. Our goal was to establish a robust, multi-study evidence base to support our next steps in preparing for future public health crises. Through this work, it became clear that while the initial focus was on pandemic-related mental health challenges, the insights gathered were highly relevant beyond the context of COVID-19. We recognized that the mental health challenges youth face were ongoing and required sustained support, which led us to transition from a pandemic-focused approach to a broader youth-centered mental health initiative. This shift allowed us to apply the evidence and lessons learned from our COVID-focused research to develop a proactive, adaptable, and user-driven mental health tool that can support youth through current and future challenges. In the next few slides, we will walk you through what we learned and how these insights shaped our future direction. We first conducted a national multi-informant cross-sectional study where we collected survey data on mental health experiences and symptoms, mental health management and health-seeking behavior, and demographic and social information on children, youth, and parents during and after the pandemic. Our 2 subsequent papers from this survey found that a significant portion of children and youth experienced worsened mental health during the pandemic. Among 933 dyads, so a total of 1,866 participants, worsened symptoms of anxiety and irritability were reported most frequently for both youth and their parents. However, youth were significantly less likely to report worse anxiety or inattention compared to parents. We also found that dyads who reported financial or housing instability or identified as living with a disability most frequently reported worse mental health, and that dyads reported most frequently accessing the internet for mental health information. Social factors, including disruptions in daily life and relationships, were significantly associated with these worsened mental health symptoms. Additionally, the internet was the most frequently accessed source for mental health information. Overall, these cross-national survey studies contextualized pandemic-related changes to self-reported mental health symptoms of youth and their families.
As part of our intentional and structured mixed methods approach, which combines both quantitative and qualitative methods to provide a comprehensive understanding of youth mental health, we conducted one-to-one semi-structured interviews underpinned by intersectionality theory. This approach allowed us not only to quantify mental health challenges through surveys, but also gain deeper insights into the lived experiences of youth and families during the COVID-19 pandemic. Each phase of our research was designed to complement and then build on the previous one, ensuring a well-rounded understanding of youth mental health needs. For the qualitative component, we included 14 youth family dyads, totaling 28 participants from across all provinces in Canada. Youth participants ranged in age from 11 to 18 years. These interviews provide rich contextual insights that added depth to our survey data. Youth and families described significant challenges navigating their emotional, psychological, and social well-being during the pandemic. Families shared various strategies they employed to manage their mental health, particularly when motivation and productivity, such as academic achievement and self-management, declined. Youth frequently reported managing their stress independently, while families expressed a lack of confidence in seeking and validating mental health information. These qualitative findings bring our survey results to life, offering a nuanced understanding of the resilience and struggles youth and families experienced, further emphasizing the need for accessible and trustworthy mental health support. We will now discuss two reviews conducted by our lab, a scoping review and a systematic review. These reviews aim to summarize the approaches and interventions used during the COVID-19 pandemic to determine which methodologies were most effective and which health domains would benefit the most from targeted interventions. So our scoping review identified, described, and categorized strategies implemented to mitigate the potentially harmful impacts of the COVID-19 pandemic on youth and their families. The broad review on approaches and strategies was subsequently narrowed in a systematic review that presents a narrative synthesis of available evidence from the first 2 years of the COVID-19 pandemic on the feasibility, accessibility, and effects of interventions to improve well-being among children and youth. The overarching aim of this work was to inform the development and refinement of interventions relevant to post-pandemic recovery. So from these two reviews, the interventions with the strongest evidence for positive outcomes included, firstly, integrating positive and preventative psychology. And these approaches emphasized equipping youth with tools to navigate adversity and build resilience, as well as recovery psychology, so strategies to support potential recovery and adaptability. Secondly, empowering children and youth. So providing agency and opportunities for self-management allowed young individuals to take control of their mental health, building motivation and strengthening their drive for personal well-being. And then lastly, teaching social emotional learning skills. So this involved increasing mental health literacy and fostering knowledge and skills in social and emotional mental health. Finally, we also found that effective mental health interventions often involved a digital health component, and that a priority among the review of studies were to increase accessibility, promoting anonymity, accessibility, cost effectiveness, and provided prompt feedback and were highly applicable to their own lives. So from this foundational work, we learned that children, youth, and their families experience poorer mental health outcomes overall and face significant challenges in navigating their well-being. We realized that what was missing was a safe and accessible way for children and youth to obtain mental health information, along with the skills and knowledge needed to feel empowered in managing their own mental health. So this brings us to our current project on co-designing a digital tool for youth mental health literacy. With this project, our primary goal was to build upon our foundational research by cataloging interventions that support youth mental well-being and creating a digital health tool in collaboration with youth and their families. This tool aims to support not just pandemic recovery, but also build resilience against future public health crises. We emphasize meaningful community engagement throughout the project. This includes involving youth and families from the outset to ensure that the tool is genuinely reflective of their needs and perspectives. Our team is dedicated to maintaining transparency and inclusiveness, compensating participants for their time and ensuring all voices are heard. This project represents a critical step forward in applying psychoeducational principles through digital means to directly enhance youth mental well-being. By co-designing with our partners, we are not only addressing immediate needs, but also paving the way for more resilient future responses to mental health challenges. So before we go through our phases of work and discuss how we built our priorities, we'd like to pose a question first, and feel free to scan the idea and the ID in the corner if you haven't already in the beginning. I'll give you a couple of seconds for that. And as you scan it, it should pop up on your phone there. And the question is, if you were guiding this program of research, what would your top priorities be? Accessibility, yeah. I'll give a couple more seconds. Equitability, yeah. Inclusivity, youth-centered and led, transparency. Yeah, these are great priorities. Access. Awesome, building capacity. Access, yeah. Well, thank you for your answers. So honestly, it's nice to see the words that have come up because they were similar to thoughts we had going in, and I can see Sonia smiling a little bit. As seen in the chat, or as seen on the word cloud, there are many ways that the tool could be built, and there's so many opportunity for change and improvement. As we move along the process, hopefully you'll see priorities that are addressed in our tool. I think you're muted, Sonia.
Great catch. Thank you. So now we're going to talk about how we went about answering a similar question. So in phase one, we convened a scientific team from across Canada, bringing together diverse experts in fields relevant to our work, such as child and youth development, clinical psychology, social work, implementation science, and many more. We also included diverse youth and parent research partners. Over 2 months, 2 working group meetings were scheduled. The first working groups meeting, the first working group's objective was to identify themes across our youth-specific pandemic research projects that we've just spoken to you about. And the goal for the second meeting was to refine those themes identified in the first meeting into strategic priorities in order to guide the subsequent phases of the youth mental health tool project. So in the end, the scientific team identified 3 strategic priorities to guide this program of research, which resemble the ones you guys just entered into the word cloud. So those included to 1, improve mental health literacy through educating youth on mental health signs and symptoms, including possible coping strategies. 2, to enhance cultural sensitivity and equitability by engaging youth from diverse backgrounds as partners to directly inform tool development. And to 3, promote accessibility by empowering youth to be informed stewards of their own mental health. The scientific team also determined 3 approaches to assess success for each strategic priority that consisted of a cross-sectional survey to pilot test the digital tool, aligning with priority 1, the collection of qualitative data on feedback for the tool specific to cultural sensitivity and equitability, aligning with priority 2, and an online short-form feedback from youth who access the digital tool in real time, aligning with priority 3. The findings from the working group were summarized into this 1-page strategic priorities document to guide the development of the tool, and you can see that on the screen here. In phase 2, we conducted a modified Delphi consensus process, which is a structured approach designed to gather experts and key informant input to achieve consensus on key issues. This method is commonly used to systematically refine ideas and generate evidence-based recommendations through multiple rounds of feedback. Our goal was to develop a set of consensus statements to guide the development and implementation of a digital mental health tool for youth. The process included 2 rounds of online surveys with nearly 400 participants, followed by 3 virtual focus groups with about 20 participants in total. In both survey rounds, we successfully met our recruitment target with over 80% of participants being youth and the remaining 20% split between researchers and decision makers. In the focus groups, we exceeded our target with over 50% of participants being youth, alongside 30% researchers and 20% decision makers. To ensure diverse representation, we achieved additional recruitment targets, with 40% of participants identifying as BIPOC, 25% as immigrants, and 15% reporting a disability. These efforts were crucial in ensuring that the perspectives gathered were inclusive and representative of diverse youth populations across Canada.
We presented 68 items that were organized into 3 domains and 8 themes. Participants reviewed and rated individual items as what they deemed important concepts related to digital tools to enhance mental health literacy among youth. We used a validated 9-point Likert scale, 1 being non-essential and then 9 being essential. The first domain was conduction of youth mental health care, and this included 3 themes: preventative interventions to mitigate youth mental health disorders, reactive interventions to address youth mental health disorders and self-guided strategies, and then approaches for youth mental health disorders. The second domain was psychosocial education on youth mental health, and this included influential factors and symptom identification for youth mental health. The last domain was youth mental health digital tool dissemination, and this domain had 3 themes: key informants to engage, strategies for implementation, and evaluation of impact. After reviewing and synthesizing the data we collected, we collaboratively developed 21 evidence-based consensus statements that were relevant to conceptualizing, developing, and evaluating digital tools for youth mental health literacy. So this process was conducted in close collaboration with youth, our partners, the research team, and healthcare practitioners to ensure that the statements were both meaningful and practical. In refining these statements, we also prioritize key principles of uniformity, simplicity, accessibility, and cohesion to make the outputs more practical and impactful for youth mental health tool development. This collaborative approach helped us create a strong foundation that truly reflects the needs and perspectives of those who will use the tool. So ultimately, the 21 evidence-based consensus statements were then grouped into 4 groups to better represent the large amount of data we had collected. So these include 4 statements on understanding mental health. An example of a statement from this grouping could be mental health can be influenced by many factors like community and online activities. Another one was mental health issues can affect physically, emotionally, in relationships or at school or work. Next were 6 statements that were focused on practicing mental health strategies. And some examples of these statements were to teach youth effective coping skills for mental health and to engage families early for long-term youth mental wellness. 7 statements addressed engaging with one's mental health, and this includes statements such as support should be easily accessible, cost-effective, inclusive, and culturally sensitive, and support should be age-appropriate and relevant so that it's used and effective. And then finally, 3 statements centered on evaluating mental health. And so 2 statements from this grouping were tracking personal goals while ensuring privacy and confidentiality, and a digital mental health tool should be routinely evaluated to assess fidelity, consistency, accuracy, and impact among youth.
In phase 3, we conducted serial focus groups with key informants and youth research partners. 3 groups of key informants were recruited to participate in 4 focus groups. The first was youth and partners. The second group of key informants was academics and researchers, and the third group, healthcare providers. Both the first and last focus groups were with youth and parents, ensuring that they had the first and last say to the tool drafting. The purpose of these focus groups was to build on the findings of the recently completed modified Delphi consensus process. To achieve these goals, we followed established guidelines for participatory research and co-design methodology in order to carry out this research and processes with youth. This approach ensured that youth felt heard, seen, and meaningfully involved at every stage. We worked to create an inclusive environment where youth could actively contribute in ways that were both accessible and impactful. Discussions highlighted several key themes that became the foundation for the development of the youth mental health tool. Accessibility emerged as a major concern, with participants emphasizing the need to reduce barriers such as long wait times, complex access procedures, and geographical limitations, while also addressing digital divides in underserved areas. Personalization was another priority, with youth expressing a strong desire for customizable notifications and interface designs to make the tool more engaging and relevant to their unique needs. Participants also underscored the importance of educational content to support a preventative approach, enabling users to better understand their emotions and mental health before issues become critical. Furthermore, the integration of peer and family support systems was seen as essential in fostering a sense of community and reducing feelings of isolation. Each of these themes served as a core pillar in shaping the design of the tool, guiding decisions on features, structure, and content to ensure it is youth-friendly, accessible, and engaging. To further amplify youth voices and perspectives in Phase 3, we partnered with the Sandbox Project to refine the consensus statements from the previous phase. Through this collaboration, we held 2 partnership-based meetings with youth researchers, ensuring their insights were central to the process. As part of our iterative approach, we shared insights and findings from our focus group discussions with the Sandbox group in between rounds, allowing for continuous feedback and refinement. The Sandbox group, composed of youth experts, aligned with many of the focus group findings, but also provided unique insights to further enhance the tool. They highlighted the importance of design sensitivity, emphasizing the use of non-triggering colors, words, and multimedia elements to make the tool more engaging. Additionally, they advocated for a holistic approach to mental health, incorporating physical health considerations such as diet and exercise alongside mental well-being. This iterative approach ensured that feedback from our various partners was continuously integrated, strengthening the tool's relevance and usability for youth. Alrighty, so that brings us to our second question for our presentation. So again, feel free to scan the QR code or go to the website if you haven't had a chance to do that already. But the question we'd like to pose to you, and the question that we asked ourselves at this point, was if you were designing this tool, what features would you want to see? And I'll just give you guys a second to simplicity. Coping strategies, medication tracking, which are very similar to a lot of the themes that were raised during our focus groups that we held. Tracking mood, interactive features, information, urgent resources. Yeah, so very, very similar to what we were picking up from our key informants that we discussed. Features that either weren't addressed by a tool currently or hard to access. Emergency help, education, resources. So that's great. Thank you guys so much for participating in that. I'll tell you our approach to it. So after collecting our results, we began brainstorming what the tool could look like within the scope of our resources. So, you know, as the first word that popped up in the word cloud, we wanted a tool that was simple, but also effective. We wanted it to be tailored to address the prominent mental health symptoms youth face today. The result was the Youth Mind Track, an interactive, fillable PDF designed as an educational and mental health management tool. We chose the fillable PDF approach for several important reasons. First, it offers interactivity, unlike a standard booklet or resource guide. The fillable journal actively engages youth by allowing them to reflect on their experiences and track their mental health journey in a personalized way. Second, the tool was designed to be youth-friendly, with a visually appealing format intentionally created to attract youth across a broad age range, from 11 to 18 years old. Third, accessibility was a key priority. We ensured the tool could be easily understood and used by youth from diverse cultural backgrounds and literacy levels, making it inclusive for everyone. Lastly, the PDF format was chosen for its ease of use. It is simple to navigate on any digital device and widely accessible without requiring any specialized software or apps. These considerations make the tool both practical and empowering for youth. We will now briefly go through the sections of the tool. Navigation within the tool consisted of a top bar and sidebar menu, as well as a simple home button to allow users to return to the home page at any point throughout the tool. And this is all explained to the youth at the start of the tool document. So as you can see on the slide right now, for this first image, understanding is underlined, and I've circled it too for you, as well as anxiety, letting the person know currently that they're in the understanding section and on the anxiety topic. And our logo here in the corner serves as a home button that takes you back to a landing page, allowing you to access different sections of the tool. So the first section, Understanding My Mental Health, is divided into 5 subsections: emotions, anxiety, depression, irritability, and inattention. Our foundational research found these mental health symptoms as those most experienced during the pandemic, and our focus groups expressed a lack of general emotional literacy for children and youth. So that's why we selected those to focus on. Each subsection covers key topics such as what it is, why do I feel it, what does it feel like in my body, in my mind, and when should I tell someone about it? Building my mental strength is the second section and includes evidence-based exercises. This section is divided into the same 5 subsections, and each contains 2 exercises. Each exercise is carefully designed to be accessible to all users, incorporating graphics that we created to enhance clarity and engagement. The presentation of these exercises is tailored to be easy to navigate, with a focus on keeping the needs of children or youth in distress in mind. This ensures that the tool is both practical and supportive, helping youth effectively build their mental strength. As you can see on the slide, the inattention subsection includes the Pomodoro technique to help youth complete tasks, and we've created some graphics to help guide them through that, as well as the 5-4-3-2-1 grounding exercise for anxiety, and youth can kind of check these off as they go through it and have something to follow.
In the third section, we cover seeking support, which includes information on the benefits of reaching out to a family, friend, or trusted adult, or reaching out to a healthcare provider. This section also provides accessible and simple steps on how to start the conversation. So as you can see on the right page, here's an example of text that is included in the tool, and it provides an example of how to start the conversation when reaching out for support. So it has specific prompts like, do you have some time to talk? I've been feeling overwhelmed lately. This section supports youth when taking the daunting task of asking for support. The Seeking Support section also features a nationwide resources page, allowing users to access an up-to-date list of national and provincial mental health resources by selecting their home province on a map of Canada. As you can see, the animation included on this slideshow shows resources from Ontario. The document comprehensively summarizes helplines, community mental health services, and their contact information from each province, and enhancing its accessibility to youth across Canada. Each list was tailored to the mental health care system in their respective province. And additionally, users who want to find a contact quickly can use the Quick Links page, which provides a concise version of the listed contacts. The fourth section is on tracking my mental health through using our habit tracker and mood tracker, which allows users to evaluate their own mental health, aligning well with our strategic goals. So as you can see on the video to the left, the habit tracker allows users to track up to 9 habits. So there you go, 9 rows. And you can check off how many days each month they complete the task as well. So for example, meditation, and then they can go ahead and check off how many times they've done it that week. Now for the mood tracker. So let's pretend it's January 1st, just like before. We'll add our month to the top right. And then let's say we weren't feeling that great this morning, so we'll check that off, but not so good in the evening. We'll check that off. And then of note, we had to give a presentation in English class today on Macbeth, and that made us feel quite nervous. So we'll add that to the note down below. And you can see that populating there. So both tools are designed for users to gain self-awareness, identify potential triggers, and to monitor their progress. They speak to a key aspect of this tool, which is sustainability. For example, how can users monitor their progress, and how can this resource support their professional care? So we have just finished conducting user testing of the tool via partnerships with youth-based and knowledge translation networks across Canada to determine the tool's usability, acceptability, and perceived effectiveness. First, we conducted a cross-national survey using validated questions, and then following this, we invited survey participants to take part in follow-up interviews to better understand their responses and overall experience with the tool. These interviews provided valuable insights into how the tool can be refined and improved to better meet the needs of youth. Results show that most participants feel that this tool is needed and has not only been effective for their mental health management, but could be effective for their peers as well. Should anyone be interested, please feel free to reach out, and we'll be sure to share our published paper on our pilot testing when it's available. So the Youth Mind Track is unique in that it was designed to address youth who have been diagnosed with a clinical mental health disorder, as well as youth who may be experiencing subclinical symptoms of mental health disorders. We accomplished this in 3 main ways. First, we included a subsection specific to how and why we feel emotions, including evidence-based strategies for emotion regulation, which is an essential yet conventionally underemphasized feature of mental health. Second, the section on seeking support that included information on the benefits of and how to seek support was developed for youth to consider at any point within their mental health journey. The nationwide resources page in this section was also incorporated a comprehensive list of helplines and community-based services, as well as specialized or referral-based clinical services, among other wellness supports. And then third, we created 2 interactive trackers for youth to track their habits and mood, to monitor personal progress, identify potential triggers, and increase self-awareness. These trackers were developed with the intention for youth to proactively manage mental health symptoms and to serve as a data-driven resource for youth to access and reference when prompting a conversation on their mental health. So looking ahead, our next steps focus on 3 key areas: knowledge mobilization, clinical implications, and future research. Once the tool undergoes peer review, we plan to make it widely accessible by hosting it on partner websites and platforms such as the Young Canadians Roundtable on Health, the Sandbox Project, and various mental health organizations in Nova Scotia. Additionally, we are collaborating with representatives from the Halifax school system to explore how the tool can be effectively integrated into classroom settings to support student mental health. From a clinical perspective, we aim to better align in clinical applications, ensuring that the tool can be leveraged by healthcare providers to support youth mental health more effectively. We want this tool to serve youth from across the spectrum of mental health and illness, as a supportive tool for those that are experiencing symptoms of irritability, anxiety, inattention, and depression. As long waitlists and limited mental health care availability continue, empowering youth with the tools to manage their own mental health can be a powerful way to prevent the progression of mental illness. Finally, in terms of future research, we see this as an opportunity to build on our work by applying the same co-design methodology to develop additional digital tools to address other critical areas. So before we end our presentation, I would just like to extend the most heartfelt thank you to our partners and funders without whom this tool would not be possible. The work we have presented to you today was thoughtfully created by researchers, healthcare providers, and youth across Canada. And while that brings us to time, we are of course more than happy to answer any questions you have about our work. You can also make note of our contact information on the screen should you want to chat further. Thank you so much.
Thank you both, Cynthia and Sonia, for a great presentation. There's a lot of work that's gone into that from a lot of people. I see our audience members have some questions, so I'm going to sort those out. What are the specific efforts and strategies to reach out and recruit young people with diverse backgrounds from a variety of different perspectives, including BIPOC, new to Canada, kids with disabilities, in the Delphi Consensus Survey Focus Group process?
Sure, I can speak to that a little bit. So there's for the Delphi process specifically, there was kind of two ways we went about it. Firstly, when completing our foundational research with key informants, we often ask if they'd like to be included in future research and use that information used that information for the modified Delphi as well to see if anybody kind of wanted to return on the topic. But we also did a lot of recruiting with our partners, so social media recruiting and posting online about what we were looking to ask people about, engage their interest on. And yeah, that's a little bit about how we go about recruiting. I don't know if there's anything I missed, if Cynthia or Stefano want to jump in with that.
No, I think that's
Keep
great. Oh,
Oh, sorry. Do you keep a database of those key informants who are interested in participating? How do you remember them for the future?
no, yeah, that's a great question. I do believe we do have a database as long as they express interest
Consent.
in
Yeah.
continuing to be part of the project. So we do have kind of a list of emails that we can contact out again. And a lot of the people that do express interest often come back to because they're just interested in the project and want to help out, and they're always lovely.
Understandable. People just really want to give back in a lot of cases.
Yeah.
Sarah asks, is this tool publicly available now?
So
And the
not
answer
So
is
not
no.
yet. It still needs to go through peer review. And we have a couple more refining and finishing up. We've done pilot testing, but we still have to go through the analysis part of it, and then kind of make the edits after that is done. So there's a little bit more work to be done. But after that, we hope to put it up publicly soon. And so I think we're planning to put it on Dr. Moss's website. And as well as disseminate it through partners as well.
And we'd also be happy from Children's Healthcare Canada to share it in our newsletter so more people have access to it as well.
That would be lovely. Thank you.
And the next question, was there a professional designer involved in the co-design process? If so, what was the role, the process? If not, why not?
So Sonia, you go ahead.
Well, I just wanted to clarify for the question. Did you mean a professional designer specifically for the methodology, like the co-design methodology that we followed, or do you mean a designer in another way? And I know you might not be able to answer it because I think you're reading these from the chat.
I'm reading them in the Q&A box, and if whoever this anonymous attendee was can clarify in either the chat or the Q&A box, I'll pass that along.
But if you had anything to say, Cynthia, regardless of the clarification, please go ahead.
No, I was just going to say, from my understanding, I feel like a lot of the design process was Sonia and Dr. Moss. Am I wrong with that? Yeah, they have I was saying this the other day that Sonia has an eye for design, and Dr. Moss is also very attention detail oriented. So
yeah, it's kind of the dream team. She has like the methodology down and then the co-design process and implementation side, and then I kind of come in with design in the other sense of the word.
Which is why you can see that our slides are so beautiful.
They really are. I imagine many of the people you're partnering with, the young folks you're partnering with, come with a great deal of creative ideas as well.
They do and they don't. Sometimes it can be quite challenging to gauge what's cool.
Yes, I'm beyond cool too. Another question about contacting you folks, but the slide is still up for those people who want to reach out to the team. But what we don't have, and it might be my old eyes, Dr. Moss's website. We can throw that in the chat. That'd be helpful to folks.
Yeah, definitely. So Dr. Moss currently has a website with Dalhousie and kind of her landing page, but I believe Dr. Moss is in the process of setting up a website that will host this tool. So you can always keep an eye out on Dalhousie page, or if you take a note of this contact information, or it'll come through CHC when it's live. We will get the information to you.
We will put it on our website as well. And thank you. There's a link there from Dr. Moss herself. Another question, can you tell us a little bit more about data security? Where will the data that youth input be stored, and how are youth users going to be informed?
Mm-hmm. Yeah, so this is something we had a lot of discussions with, because I think when you hear about a tool like this in today's day and age, one of the first things that pops to your head is an application, like a phone app or an iPad app, because youth, everybody's on their phones, and it can be quite user friendly to use an application. And because of our resources at the time, but also because of this data security aspect, we went for the fillable PDF route at the moment, where the file is saved on the user's device or drive. We don't have access to what's being entered into that. Nobody else has access. Youth have the option to password protect it at home if that's something that they require or would like. But the data itself, it's like a journal. It's their personal document for them to share with a healthcare provider or counselor or whoever if they choose to, but the access of that kind of lives on their personal device.
That makes sense. And when you take in some of that data and analyze it from a research perspective, is it stored any differently?
So currently, we're not doing any analysis of the data that is entered into the tool. We're just right now kind of after doing all the research and co-design meetings and surveys and whatnot to get to this point of designing, we're now pilot testing their experience with the tool, but not doing any research currently with their inputs specifically to their mental health experiences.
And how do folks contribute to the research program if they want to?
So you can, of course, email Dr. Moss or any one of us, and we'd be happy to get anyone who wants to be involved. And there are lots of different ways that you can do that. You can participate in our studies if that makes sense, or that's what you want to do. You can also disseminate research opportunities within your personal networks, as well as just if you want to be updated on our research as well. So feel free to show.
Another question. I'd like to know about a sustainment plan of the tool. Once research funding ends, who will own and update and manage the digital tool?
Yeah, that's a great question. Sorry, go for it.
No, I was going to say that is a good question. We tried our best to build it so it was sustainable. So, for example, the nationwide resource guide that was made so that it was that would be connected to the internet, and we could update it more easily, and it was built that way so that it could be easily updated. As for the other information, I think we'll continue just to review it as years go by, but I think it should be sustainable, like just the content itself, because of the massive work that's been done. I don't know, Sonia, if you have anything to add to that.
No, I think you explained it perfectly. I think as we kind of mentioned throughout the tool, sustainability was part of our strategic priorities and also something we thought about, throughout the process. And the reason why we liked this idea of the fillable PDF and only, as Cynthia mentioned, hyperlinking these nationwide resource documents, because it came up in our focus groups. And I think it also came up in our activity that we just did, that there's a great need for an up-to-date list of resources and how to contact these support services, that the information is often changing and whatnot, and we wanted to be able to address that gap. So that will be monitored by Dr. Moss's lab or whoever is working on this. Let's say like long-term time in the future. We're hoping that this will last, and then they'll be able to access those documents that are hyperlinked into the tool itself. So those won't change. And then everything else kind of Cynthia I think mentioned.
Thank you. What advice do you have for clinicians on their using this tool with their the young people they serve?
Yeah, no, that's a great question. So this tool was built so that it could be easily distributed because it is a PDF. So that's great in itself. And then there's also a feature of the habit tracker and the mood tracker that we had discussed as well. And that kind of allows more of like a quantitative way to observe a young person's progression and how they're dealing or managing their own mental health. And so that's a great way to kind of understand like a young person or a patient and see how they're doing over time. And it can kind of build a relationship as well with a young person too. I also find that sometimes younger people are also a little bit more shyer, and so it's harder for them to come out of their shell and like describe exactly how they're feeling. So that the tracker and those tools of notes that you can read off of can be really helpful. And as well, if someone is just kind of like a young person that might be more hyperactive and not really able to kind of string along what they want to say, the Notes app can also be really helpful for that. And those trackers can be helpful for that. So it's a great supportive tool for clinicians in the future. And also, sometimes you don't really get that much time with the patient or with a young person. And so this will be a great way to be able to teach young people as well how to manage their mental health too. So lots of ways that it can help in clinical care.
And how will you be monitoring the tool over time to ensure that it meets the needs of diverse groups as you apply it or even revise it as new data comes to light?
Yeah, no, that's a great question. I think we'll continue to kind of observe how it does and iteratively gather feedback. And that is definitely like a long-term plan that we need to set out for sure.
Mm-hmm. And I'll just add to that, as Cynthia mentioned just on a slide, one of our closing slides, that our lab is hoping to use the co-design methodology and process that we used for this on other projects as well. And I think through that sort of application, other things might come to light. I know Cynthia and I have learned so much about youth participatory research throughout this, and so many things that we could do better if we were to go forward with the changing landscape in Canada for this research. So I think it's just a continuous cycle and not being shy to come back and make those improvements, because as we've emphasized, our primary goal is for this tool to be helpful, and we want to ensure that it is. So I think we're all very committed to that.
Well, thank you both so much. That's the end of our time together today. Thank you both, Sonia and Cynthia, for your time and sharing your time and expertise. We know how busy you are, and our audience, thanks for joining us. We know how busy you all are right now. Coming up in the coming weeks, stay tuned for some additional offerings. In case you missed it, we have a podcast entitled Right Sizing Healthcare Systems for Kids, Primary Care Access, with Dr. Tara Kiran. That is now posted live. Have a listen. It was a really lovely podcast to listen in on. And save the date for the annual conference. Children's Healthcare Canada's annual conference is taking place in Ottawa this year at the West End from April 14th to 15th. Registration will open on January 29th. There'll be a notice in the February 1st newsletter. If you're not a subscriber, feel free to visit the website at childrenshealthcarecanada.ca and subscribe. It's always great if you watch live as your guide. Questions and comments really enrich the discussion and the content. But if you can't, the recordings of these sessions are made available after the fact on our website. Thanks again for joining us today. Thanks to our wonderful speakers for this presentation, and hopefully we'll see many of you back here soon. Bye, everyone.